Suffolk Community Health point of view, the idea of Connect is to reduce the duplication of the work that is given to us from the referrals that we get. So when a patient puts a referral in, rather than a kind of scattergun effect of the referral process, so rather than going to 3 different agencies, say going to Adult Community Services, Home First and Suffolk Community Health, the idea is that it should all go to one person so that we're all communicating with each other.
I'm an occupational therapist within Adult and Community Services, and Liz is an occupational therapist working
with the local healthcare team in Suffolk.
And we started to meet regularly from April 2016. One of the initial benefits is to avoid duplication of services, so a person only has to tell their story once to a professional. That's one of our aims. Also, we hope by sharing information that we get a more rounded picture of the people we go and see when we go and see them.
In that I work as part of a multidisciplinary team, so perhaps if I myself haven't been involved with a patient, then the nurse or the physiotherapist might have some history.
And equally, from an adult and community services point of view, I can share some information as to whether my wider team has been involved and when they're involved. It helps us to know when there's been interventions by someone beyond our service, because we can't share the data between adult and community services and the health service at the moment. And that helps us to give a more complete picture as to when there's been an intervention, such as has the district nurses been involved or have physios been involved, and likewise for Liz.
It also helps us end to end. If you think that our role extends from health promotion, prevention, right through the re-ablement focus into rehabilitation and discharge planning, if we actually have to transfer a client's care from one agency to another, there is that overview perspective that we can present. So I am part of the steering group that meets monthly, and for me it's given me a much broader understanding as to the local structure that supports individuals. So we have representatives from the police force, representatives from local independent and third sector, voluntary sector agencies, as well as statutory agencies like health and social care. So it's just painting that overall scene as to what support services and structures are available to individuals.
And I think also our 2 teams meet together for an informal session, so it's a chance for not only us but our colleagues to meet together, and we have topics which we discuss, which we share and bring views from both teams on those topics. And
so it's shared training, shared learning, shared resources in terms of what equipment might be available, what the adaptation routes for individuals might be. So yes, that kind of greater resource really.